most famous physical therapist on the internet.
Hi, folks. I'm Bob Shrupp, physical therapist.
Brad Heineck, physical
Because
therapist.
we are the most famous physical therapists on the earth.
In our opinion, of course.
Today, we're going to talk about hip pain, arthritis. We got 8 strongly recommended treatments by experts. And who are these experts? I'm going to reveal this right away, Brad.
Okay.
It's physicians from the American College of Rheumatology and Arthritis. So all these doctors get together. In 2019, they did this. They've been doing it for years. They re-update it every so often. And they look through the research. They scanned all the research that's out there. And they figure out what is working and what is not working.
Sure.
And they kind of hedge their bet by they'll say they strongly recommend, or they just recommend, or strongly recommend against.
Okay.
So
the pros, what's going to make it better, what's going to make it worse, and in between.
So I picked out only the stuff that they strongly recommended for hip arthritis.
To make it better?
Yeah, to make it better.
Okay.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. This week, we're giving away a Bob and Brad blood pressure cuff.
Blood pressure cuff.
Yeah.
Excellent.
Awesome. You can also go to Facebook. It'll be pinned to the top of the page. The contest. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program where we don't ramble. And what else, Brad?
We also now have podcasts out there interviewing outstanding authors, people with PhDs, a lot of smart people. And we have some of our own stuff in there as well.
Yeah, well, this one's probably going to be podcast.
Okay,
so,
good.
All right, number 1. No surprise here. Hip exercise is strongly recommended for patients with hip osteoarthritis. Now, when I think of hip exercise, I think of stretching. Because we want to make sure the hip has as much motion as possible.
Right. Maintain the motion.
And we've got lots of videos on that, right, Brad?
We do.
And what else?
We have a program section on it.
No, I know, but hip strengthening. That's
range of motion, stretching, and strengthening. Oftentimes, we're therapists. We believe, those are cousins or
there we go. Kiss the cousins.
Yeah.
So the thing is, as you get pain in a joint, you stop using it as much and it becomes weak. So it's really important that you do some strengthening exercises. So look up Bob and Brad for hip exercises, stretches for pain, and also hip strengthening.
Yep. So again, do these with, and we always talk about this. You're not going to do them if they create pain, particularly sharp pain. You're going to find out which exercises are tolerated and stretches are tolerated well and make it feel better, and then go from there.
Let me just say this too. It can make a huge difference. It can take people from having pain to no pain. Even though they have osteoarthritis, doesn't mean you're going to live with pain. I mean, so yeah, I definitely give this one a try, number 1. Number 2 is, again, probably blatantly obvious, but weight loss is strongly recommended for patients with hip osteoarthritis if they're overweight or obese. Now, I know this is daunting for many of you, but even a loss of 5% of body weight, they found, can make a big clinical or mechanistic. There we go. Mechanistic outcome.
Yes.
So
otherwise, it doesn't take. You don't have to lose a lot,
50 pounds,
but part of it, and it's going to help you out.
Right. So give it a shot.
Yeah, and we know that's difficult. It can be a real challenge for anyone to lose weight, but it can help.
I'm not sure what this one means, but I'm going to give you my interpretation. So they found they strongly recommend self-management programs. And I think the idea behind this, and this is, Brad and I have talked about this a lot with patients. You've got to feel like you're in control and that you're in charge of getting this better. If you're waiting for somebody else to give you a pill or something, or to take care of it, no, you gotta take it under the bull by the horns, right?
Well, a good example is the first two you just mentioned.
Right.
You got to get your exercise, your strengthening, your range of motion, and then change your diet, and see if that can help lose some weight. And those two things, that's all under your own self-management. You're in control of that.
I think this is a good time to mention, Brad. They didn't include this, but and You know, physicians are a little bit slow to embrace this, I think, but there's definitely anti-inflammatory foods,
Right. I
and
agree.
you may want to, I would check that out because you might be able to knock things down, the pain down, just by partaking in some of those.
You're definitely going to lose some weight if you happen to have not such a good diet. If you eat a lot of carbs and sugars and that kind of thing, it's just
Right.
all part of the
All right,
problem.
number 4, Tai Chi is strongly recommended,
Mm.
and not surprisingly, because when you have knee or hip arthritis, it's not only slow, gentle movements, graceful.
Hmm.
It's also good breathing and relaxation, but you're
Right.
getting strength, and it's also helping your balance,
Right.
and so you're going to prevent falls.
I'm kind of surprised they didn't have yoga in there too, because it's there's so much. I've never taken either one. I'm more familiar with
Right.
some of the Tai Chi, but one way or another, it's a part of one in range of motion. The
Got to be
first
careful
one.
of the yoga. Sometimes some of them are really good, and some of the exercises may not be good for your hip.
In our opinion, of
In
course.
our opinion, of course. Yeah. Hey,
yoga
sorry,
people
yoga
get
people.
mad at us.
All right, number 5. I was glad they had this one, Brad, because on one study I saw where they didn't recommend it, and they recommended use of a cane.
Mhm.
I always say to people, I'm not saying that you have to use a cane forever,
Hmm.
but sometimes the hip kind of flares up. And if you can actually use the cane to let it calm down
Yep.
and maybe do some strengthening while you're using the cane,
Hmm.
I think it makes a big difference. Because if you start, for example, you're not using the cane and you're waddling along
Because of the pain.
because of the pain,
Mhm.
that actually makes things worse.
Right.
So and people go, well, I'm not going to use a cane. I'm not that old, and they'd rather waddle along and really draw attention to themselves as opposed to if they use the cane and walk normally.
Right.
So
Yeah, it is one of those things you just kind of have to, just think of cane giving you some dignity.
right,
There you go.
or use a single crutch or a walking stick or something. If it's a
Yeah.
little less obvious. All right. Number 6, oral NSAIDs, non-steroidal anti-inflammatory drugs. They're strongly recommended for people with hip OA. So,
So we're talking like ibuprofen,
right.
Aleve, Tylenol, those types.
Tylenol is not
Oh,
an
that's right. I
Yeah.
get. I'm glad you picked that out. But also make sure you are aware of if you're taking other medications. You should talk to your doctor and find out if there's any precautions
Well,
with
even
an
the
NSAID.
ibuprofen, you're only supposed to take, it can be hard on your stomach.
Yep.
You got to take it with food.
Yep.
We're not doctors, we're not pharmacists. So, get advice from them people.
We do have two outstanding videos with a pharmacist talking about these. If you Google Bob and Brad, Tylenol and ibuprofen, they'll
Sure.
both come up, and you'll get some good, excellent information
Yeah.
on that, details.
Number 7, number 8 are kind of similar, Brad. They're both talking about glucocorticoid injections, in other words, steroid injections. And they're both recommended. The one said it's the one basically says for the hip, they recommend that you use the ultrasound guided version.
And you don't have to worry about this. A doctor makes a decision for you. But
Well, you want to make sure the doctor's doing it. That he's not going to just stick in there blindly. He's going to have, because they used to do that. They used to never use ultrasound to guide it.
yeah.
And they did it in the back too, which I
Yeah.
would never get a cortisone shot in my back without it being guided.
In other words, if the doctor doesn't do it, you may want to go to a doctor that does use so they can actually see the needle go in,
Right.
and it goes to the joint or
Right.
the specific area without near as much guessing. It's much more accurate. So if a doctor says, well, I don't do that because I don't feel I need it, you could say, well, maybe I'll go to someone else
Right.
who does have it.
Now they did say it's okay in your knee to have not used the ultrasound.
Mm-hmm.
Apparently, it's just pretty easy to find the spot.
It's more superficial.
And the same with your hands.
Sure. Right.
But for the hip, they think you should be guided by the. This is something you can't do too much of because you can't take too much steroids.
Right.
But they'll know that. I think they can usually do 2 shots a year, maybe 3 shots a year.
Yeah, I've had patients. Yeah, so they're actually putting that needle with the steroid, and they try to get it, I believe, right into the capsule of
Sure.
the hip, and that
Makes sense.
It is. How are you going to see it, because it's there's a lot of soft tissue around that
Right.
joint.
I just have had people that have really done well with it. I've had people
Yeah.
that didn't know at all that even helped.
Right.
made a difference. So,
Right. Yep.
but it's enough that the research has shown that it's definitely worth a try.
Sure.
Strongly recommended.
Yep.
So there they are. You can actually look these up yourself. Just look up 2019 American College of Rheumatology Arthritis guidelines. I think for hip or for osteoarthritis, and it'll pop up.
And then you don't have to listen to us babble on.
That's right. Good for
It's
you.
a bonus. All right. Take care, and we hope your hips last a long time.
Yeah, there we go.